3 people take a pill every single morning for the exact same reason: high blood pressure. One of them slowly develops puffy, swollen ankles. One can't shake a dry, scratchy cough that no syrup will fix. And one just feels oddly weak and tired with no idea why. 3 completely different problems, and almost none of them realize the answer is sitting right there in the palm of their hand. Because here's what most people are never told. Amlodipine, Lisinopril, and Losartan are not 3 versions of the same drug. They lower your blood pressure in 3 completely different ways, which means they can go wrong in 3 completely different ways too. Stay with me, and I'll show you what each one is really doing, the warning signs that actually matter, and the surprisingly ordinary habits that can quietly turn a safe pill into a risky one. Let's clear up the biggest misunderstanding first, because everything else depends on it. When a doctor says blood pressure medication, it sounds like one thing. It isn't. These 3 drugs belong to 3 separate families, and they each attack high blood pressure from a different direction. Think of your circulation like water moving through a network of pipes. Amlodipine is a calcium channel blocker. Its whole job is to relax the muscle in your artery walls so the pipes widen and blood flows through with less push behind it. Lisinopril is an ACE inhibitor. Instead of touching the pipes directly, it switches off a chemical signal your body uses to tighten those vessels. Block the signal and the vessels stay loose. Losartan is what's called an ARB, an angiotensin receptor blocker. It works on a similar tightening signal, but instead of stopping the signal from being made, it blocks the docking stations where that signal would normally plug in. Same goal, different doorway. Why does this matter to you and not just your pharmacist? Because each doorway comes with its own quirks. The side effect that's completely normal for one of these drugs would make no sense for another. Once you know which family your pill belongs to, you stop guessing, and you start recognizing. Let's start with amlodipine, and the side effect that sends more people into a late-night panic than almost any other: swelling in the feet, ankles, and lower legs. Here's the reason. In plain terms, amlodipine is very good at relaxing the small arteries carrying blood into your legs. But the veins carrying blood back up don't relax in the same way. So, more blood arrives than leaves, pressure builds in the tiny vessels around your ankles, and fluid gets nudged out into the surrounding tissue. The result is puffy ankles, sock marks that won't fade, and legs that feel heavy and full by late afternoon. Now picture someone in their 70s who notices their shoes suddenly feel tight. It's easy to leap to a frightening conclusion. Is my heart failing? Is my circulation shutting down? And it's easy to quietly start cutting back on walks and activity. But in most cases, this swelling is not heart failure, not failing kidneys, and not too much salt. It's a predictable, well-known reaction to how this specific drug works. The danger usually isn't the swelling itself. It's the panic decisions people make around it, silently stopping the medication, or drastically cutting fluids because they assume they're retaining water, which can actually leave them dizzy and dehydrated. The right move is simple. Don't suffer in silence and don't adjust things on your own. Swelling on amlodipine is a flag to raise with your doctor, because there are often easy fixes: elevating your legs, changing dose timing, or switching to a medication your body tolerates better. And here's a lesser-known one. Most videos skip. Calcium channel blockers like amlodipine can also cause your gums to overgrow and become puffy or tender. If your dentist suddenly comments that your gums look swollen, that's worth mentioning your medication list. It's a real documented effect, not a coincidence. Now to lisinopril and the side effect it's famous for: a dry cough. Not a chesty, productive cough. A persistent, tickly, scratchy cough at the back of the throat, often worse when you lie down at night, and stubbornly immune to lozenges, antihistamines, and cough syrup. The tricky part is the timing. This cough doesn't always start on day 1. For some people, it shows up months into treatment. which is exactly why so many people never connect the dots. Someone who's been fine on the pill for 3 months blames pollen, dust, a lingering cold, or acid reflux. They'll spend a fortune on air purifiers and allergy tablets while the real cause sits in their pill organizer. The cause is a buildup of a natural substance called bradykinin that ACE inhibitors leave behind, and it irritates the airways. The good news, switching to an ARB like Losartan, which works on a related pathway without triggering this, often clears it within a couple of weeks. But I need to draw a hard line here, because in the same drug family there's a reaction that is absolutely not a nuisance. If you're taking Lisinopril and you notice swelling of your lips, tongue, face, or throat, especially with any difficulty swallowing or breathing, that is a medical emergency. Do not wait until morning. Do not try an antihistamine and see how it goes. Call emergency services right away. This is called angioedema. It's uncommon, but it's real, and it can affect your airway faster than people expect. Keep this simple rule in your head. A dry cough is an annoyance, but throat or tongue swelling is an emergency. Losartan brings a different and sneakier risk, and what makes it dangerous is that it usually strikes people who are trying to be healthy. Both Losartan and Lisinopril can nudge the potassium level in your blood upward. For most people, that stays in a safe range with normal monitoring. But stack the wrong habits on top and the picture changes fast. Here's the trap. We picture potassium as bananas and supplements. But it's also hiding in products sold as the healthier option, salt substitutes. Walk down the grocery aisle and you'll find low-sodium or heart-healthy salts sitting right next to regular table salt, and many of them simply swap sodium for potassium chloride. So an older adult who's been told to cut back on salt buys one of these, sprinkles it generously on every meal, and is now pouring potassium into a system that their medication is already pushing higher. The reason this is risky is that potassium controls the electrical rhythm of your heart, and it rarely warns you loudly when it's climbing. It can show up quietly as unusual muscle weakness, fatigue, leg cramps, tingling hands, or a fluttering, irregular heartbeat, sometimes with barely any warning until it becomes serious. The same caution applies to electrolyte powders, recovery drinks, and some meal replacement shakes. They're sold off a normal shelf, so nobody thinks to mention them, which is exactly why they slip through. If you take Losartan or Lisinopril and you've started using a salt substitute or daily electrolyte product, flag it at your next appointment. Beyond the salt substitute trap, there are a few everyday situations that turn these 3 drugs risky, and they all share a theme. They're so normal that nobody connects them to the prescription. First, painkillers. When your back or knees ache, reaching for ibuprofen or naproxen feels harmless. It's right there on the shelf, no prescription needed. But these anti-inflammatory painkillers reduce blood flow to your kidneys. Combine them with an ACE inhibitor, or ARB, and especially with a water pill on top, and you've created what doctors literally call a triple whammy that can injure the kidneys, particularly if you're even slightly dehydrated. Your kidneys don't care whether a drug came from a pharmacist or a supermarket shelf. They only respond to the chemistry. If you regularly use these painkillers for arthritis or chronic pain, ask about safer options. Paracetamol, also called acetaminophen, topical gels, or physical therapy can often carry far less risk. Second, getting sick. Not hospital-level sick, just a stomach bug, a couple of days of vomiting or diarrhea, or a hot stretch where you've sweated a lot and underdrunk. When you're dehydrated, the exact same dose of Losartan or Lisinopril that suited a well-hydrated body can suddenly drop your pressure too low and strain kidneys that are already short on fluid. The drug didn't change. Your internal conditions did. This is why every person on these medications should ask one specific question before they ever need it. If I get a stomach illness and can't keep fluids down, should I pause my blood pressure pill, and when do I need to call you? Write the answer down and keep it with your pills. It's one of the most useful and least asked questions in all of blood pressure care. And a third one people rarely think about: alcohol. A drink relaxes your blood vessels and mildly dehydrates you, the very same directions your medication is already pushing. Together, they can amplify dizziness and low pressure more than you'd expect, especially in warm weather or on an empty stomach. No matter which of these you take, a handful of habits protect you. Rise slowly. That brief, dizzy, room-tilting feeling when you stand up too fast happens because your medication is lowering your pressure and your body needs a second to catch up. It feels minor, but in an older adult, a few seconds of unsteadiness can mean a fall, and a fall can mean a hip fracture that reshapes the next several years of someone's life. So sit on the edge of the bed before standing, hold something stable, and give yourself a few extra seconds. The occasional wobble is normal. Dizziness that keeps happening, or any near fainting, deserves a real conversation about your dose. Measure your blood pressure properly, because most home readings are done wrong, and a bad